everyone. Welcome to Implant Expo 2021 by Dentistchannel Online. Myself, Dr. Isha here, and I will be the host for today's webinar. So today we have Dr. Kushal Singh, and he will be giving us, presenting a small webinar on thread designs in dental implants, which seems like a very interesting topic. First of all, my warm welcome to Dr. Kushal. Thank you so much for coming on with Dentistchannel Online to talk on one of the most interesting topics in implantology. So welcome, Dr. Kushal. And I think we will not waste any time and start with the webinar. So before we start with the webinar, I'll give a small introduction about Dr. Kushal. That is, he has done his BDS from Trikanter Mahavi Dental College, Muradabad in 2005, and he has done his MDS from Kiri Dental College, Department of Prosthodontics in 2011. He's currently associate professor in RR Dental College at Udaipur, and he has been practicing implantology since past 10 years and also practicing, he's also practicing in Wisdom Hospital simultaneously in Agra. So I think today's webinar is going to be one of the great webinars. And okay, and to all my participants, if you have any questions in between of the webinar, kindly put those questions in the Q&A box. Do not put them in chat session, and your questions will be answered by the end of the webinar. Thank you, and over to you, Dr. Kushal.
Thank you so much for the nice introduction. Thank you, Dentistchannel Online, for giving this opportunity for this webinar. Now, without wasting time, I would start my webinar. Okay. Now it is visible to everyone.
I think the presentation is not visible yet, Doctor.
It's loading. We will wait for a moment.
Yeah, it'll come.
Hello.
I think, Doctor, you can just try. Yeah, try it again once.
Now it is visible?
No, Doctor. No, it is not.
Okay, I'll have to share.
Well, to all the participants and attendees, well, technology has its own glitch. There is some problem with Dr. Kushal's screen share. So we'll be resuming the webinar as soon as possible.
Okay, now it is visible?
No, Doctor, it is not.
Oh, there is some error.
Yeah, it's visible now. Perfect.
Okay,
Perfect.
okay.
Perfect. Yeah.
Okay, let's start with the thread design is very important in dental implants. We often do dental implants, and we all our colleagues were doing this for a very long time. Everyone has got to know about the designs of implant. There are various designs pattern regularly updating time by time. As first we started with transosseal implants in earlier time, then we have started the basal and cortical implants. Nowadays we are having some more implant designs, so which is very easier for us for doing such cases on full mouth, on delayed loading, while immediate loading. Now I am starting my topic. My topic has following contents. First of all, introduction, then the implant design related to occlusal forces, then our implant body, then the implant design, and then the implant body design and body size. And the last, there is a conclusion. For the introduction, we'll have the treatment planning sequence of implant dentistry begins with the design of final restoration. The greater the force factor and the greater the implant support required. The key implant position and additional implant number, and then determined, followed by the ideal implant size. When the bone available is present for the size, number, and position of the implant prosthesis, the treatment proceeds with little compromise. Now the modifications in this, we are having the bone augmentation to fulfill the ideal treatment plan, consideration of optional implant location, usually with additional implant or increase in implant size. And in optimization of dental implant design, the dental implant is often designed to answer a belief that implant failure may stem from while doing the implant surgery, or getting a bacterial plaque, or on the loading conditions. The feature designed to decrease the bacterial complication usually increase the
Excuse me,
risk.
sir.
Yes,
Excuse me,
hello.
sir. Sorry for your slides are not moving. Please move the slide. Thank you.
Okay, slides are not moving.
Still, we are on which slide?
Still, we are on the first page.
Yes, sir. What we can do is we can probably just click on slide share and then try to go with the arrow button on the keyboard.
Okay, slide share. Now you can visit. Now it is visible.
No, sir. There is an option of slide share at the end of the presentation only. In the PowerPoint presentation, it might be small icon is there. So once you
Yeah,
click on that,
slide share, slide sorter है normal and slide show.
yeah, probably slideshow. You can just click once and
Yeah,
then
I have click on the slide show. Now it is visible.
no, it is not showing any change in the presentation.
Okay, I'll connect with it.
Sure, sure.
Okay. Now you can see.
Yeah, we can see the slide, but we can just try moving the slide once.
Okay, I'll move my slide. Now I'm changing the pages.
No, doctor, the pages are still not changing. They are the same.
Okay, now
No, it's not happening.
something is wrong. Hmm. Now I'm moving my pages. It is. Okay, now
No, doctor, nothing is happening.
slide now. ये तो sorter है.
What you can see on the screen now.
Anything visible now?
No, doctor, nothing is visible.
So can you please help us? So how can we connect with this?
Doctor, we did that is the only procedure. What was just you open your PowerPoint presentation and you just click on screen share and it just shares the screen. Simply PowerPoint presentation it shares. So if we can just try it once more.
Now
Because that is the only way to get the presentation on the screen. I think there must be some problem with the laptop or the Zoom or
can I
something.
share entire screen?
No, if you share the entire screen, the video call will come. So you have to share the presentation itself.
Okay, I'll share in Windows now. I'll open it.
Or what we can do is, if this is not at all happening, then you can just deliver the lecture without the presentation. If that's okay with you.
Yeah. This is, but it is not unable to people
Pictures.
without pictures. They will not can't understand what I am getting to tell them.
Yeah.
Last draw करो.
Now you can. It is visible.
No, doctor, no. I'm so sorry, but it's not at all visible.
Hello.
Yeah, doctor, can you send me your presentation so that I can share it from my laptop? I think that will be easy. Just
Yeah, sure.
just WhatsApp me your presentation, please.
I'm sending on mail.
I'll send you my email ID.
Okay.
What's the web में कंप्यूटर से
अच्छा
तो क्या भेजो.
We are extremely sorry, guys, for the delay. It usually does not happen, but you know, technology has pros and cons both. But we have to rely on technology nowadays. So please give us another 5 to 10 minutes.
दीदी व्हाट्सएप बैक खोला लो
Hi, Dr. Kushal. I think it's on screen share now. Dr. Kushal, can you hear me?
Yeah, hello. Yeah, I can hear you.
Yeah, now I'm sharing the screen, and now we can start with the presentation.
Okay. Okay. Thank you so much.
No problem. Doctor, can we start with the presentation, please?
Yeah, sure. How can I change the slides now?
I will be changing it. You can just tell me that when to change. I'll change the slide. You can just tell next slide. Yeah.
Okay. Okay. Let's start once again. Now we are talking about the implants and especially the thread designs in the dental implants. First of all, the contents. In contents, we'll discuss about the introduction, implant design related to occlusal forces, then the implant body, implant designs, and implant body size and its design. And at the last, we'll conclude with the conclusion. Now, next, in the introduction, the treatment planning sequence for implant dentistry begin with the design of the final restoration. The greater the force factor, the greater the implant support required. Now, the key implant position and additional implant number are then determined, followed by the ideal implant size. When the bone available is present for the size, number, and position of for the implant prosthesis, the treatment proceeds with little compromise. Okay, next. These modifications includes the bone augmentation to fulfill the ideal treatment plan. Then we'll consider the optional implant location, usually with the additional implant or the increase in the implant size. Or thirdly, we'll optimize our implant design. The dental implants are often designed to answer a belief that the implant failure may stem from while doing implant surgery or having any bacterial plaque or on the loading conditions. The feature designed to decrease the bacterial complication actually increase the risk. Now the next slide. Therefore, an implant body design of ease of surgery or to reduce the peri-implantitis complications most often does not address the most common complication observed in the implant prosthesis. Now we'll talk about the implant design related to our occlusal forces. It is a very how will balance our occlusal forces on implant prosthesis. The dental implant function to transfer load to the surrounding biological tissues. Thus, the primary functional design objective is to manage biomechanical loads to optimize the implant support and its prosthesis function. Biomechanical load management is dependent upon the two factors. First, the character of the applied force, then the functional surface over which the load is dissipated. Now, next. Force type and influence on the implant body design. The three types of forces may be imposed on dental implants within the oral environment. First is compression, then tension and shear. An implant has a microscopic body design are often most important during initial implant healing and initial loading period. The smooth-sided and cylindrical implant provide ease in the surgical placement. However, the bone implant interface is subject to significant and larger shear conditions. Next. The greater the taper, the greater the component of the compressive load delivered to the interface. Unlike in the cylindrical implants, the taper threads implant serves no functional surface area advantage because the threads of the screw bears the compressive loads to the bone. Now next. Now another we'll discuss on the force direction and the implant body design. When the bone is weaker and will load with an angled force, the greater the angle of the load, the stress to the implant bone interface is larger. 30-degree angle load with increase of overall stress by 50% compared to the long axis load, especially around the crystal portion. Now next. These are the four basic shapes of the implants design, which usually we'll use nowadays. Now we'll talk about the implant body. The forces applied to the implant may be evaluated to the magnitude, duration, type, and directions. The surface area over which the forces are applied is also relevant, and it's inversely proportional to the stress observed within the implant system. In contrast to the functional surface area is total theoretical surface area, which may include a passive area on the implant and that's not participate in the load transfer. Now, the diameter of an implant influences the length requirement of the implant body because the functional surface area is also increased. An ideal treatment plan would include the implant length of around 12 mm or greater than within the 4 mm of diameter for most anterior implant sites, or having 5 mm or greater in the molar region. This is the ideal treatment design. Or now we'll talk about the implant design. Cortical and the trabecular bone are modified by modeling or remodeling. The modeling is a result of independent sites of formation and resorption that change the shape and size of bone. And now the remodeling is the process of resorption and formation at the same site that replaces the previously existing bone and is primarily responsible for the change in bone quality. Now the lamellar bone is the most organized and highly mineralized and the strongest of the bone types. This also been called as the load-bearing bone, and it's the most desired next to implant. The laminar bone is very important while doing the while planning our cases for the implant surgery. Will have it is the most organized and highly mineralized because it's having the strongest. It is one of the strongest type of bone, and also it is called as the load-bearing bone. Okay, next slide. Woven bone is also called immature bone because it's unorganized, less mineralized, and having a less strength than the other types of bone. Now we'll talk about the thread geometry of the implant design. There is a major diameter, down the mean diameter, and the minor diameter. You can see where is the crest and the pitch. Crest and the pitch is the only design which we are having nowadays. We are having very modified designs of pitches and crest in the implant threads. Now the next slide. The thread pitch is the distance measured between the adjacent thread measured on the same side of the axis. It also refers to the number of thread per unit length. Therefore, when the implants have the same length and a smaller pitch indicates more thread, leading to the greater surface area. Another geometric parameter related to the thread pitch is lead. Lead is the distance that a screw would advance in the axial direction per one complete revolution. Okay, next. Now the thread pitch. This is the diagram of thread pitch. Here you can see the pitch and the root inter distance of the threads is known as the distance of pitch. Now the next slide. In a single thread screw, lead is equal to the pitch. However, is the double threaded screw, lead is double the pitch, and in triple thread, lead is triple the pitch. An implant with double threads would insert twice as fast as a single thread, and the triple thread would only need a third of the required time for a single thread. Now in the next slide. Now the thread shape. In general, bone is constantly remodeling itself to adapt to external stimuli in the surrounding environment. This is known as the bone homeostasis. When an implant receives optimal functional load, the surrounding bone experiences remodeling and produces woven bone. The type of force applied at the implant bone interface may influence the degree and the strength of osseointegration. The three types of load are generated at the interface: compressive, tensile, and the shear forces. These are the types of load generated at the interface while placing the implants. Now the next slide. There are the thread shapes in this figure. You can just figure out that what thread shapes while using nowadays. It's invert, reverse, and conical, and flat and taper. Okay, next. Now the crest module consideration. The part of implant in contact with cortical bone near the crest is called the crest module. The crest module of an implant body is a transosteal region which extends from the implant body and often incorporates the anti-rotation components of the abutment. Implant has a surgical influence, a biological width influence, a loading profile consideration, and a prosthetic influence. During the surgical phase, the crest module design primarily benefits the crestal implant interface. The crest module of an implant should be slightly larger than the outer thread diameter of an implant body. Now the next slide. The crest module of an implant should be slightly larger than the outer thread diameter of the implant body to completely seal the osteotomy, providing a barrier, and acts as a deterrent to ingress of bacteria and fibrous tissue during the initial healing. Now the next slide. Now we'll talk about some implant system available in India and their thread design. The V-shaped thread is very common. We'll use using Noble Biocare. Noble Biocare prefer V-shaped thread. Now the square thread, it is very common in Biohorizon implant. It's the external implant system. Now we'll talk about buttress thread. It is Straumann standard has maintaining this buttress thread. Now we'll talk about the reverse buttress thread. Noble replace it's by the Noble Biocare. Now we'll talk about square thread. It is used by Adin implant system, and buttress thread also used by the Indian implant, that is Genesis implant. Now the another one is the press fit design. It is used by the Zimmer implant systems. These all implants companies commonly will use in our day-to-day practice. Now the apical design consideration. An apical portion of a root form implant is most often tapered to permit the implant to sit within the osteotomy before the implant body engages to the crestal bone region. The most root form implants are circular in cross section. This permits a round drill to prepare a round hole precisely corresponding to the implant body. A disadvantage of the apical hole occurs when the implant is placed through the sinus floor or become exposed through the cortical plate. Now in the next slide. These are the apical end implant which will be flattened rather than pointed and having a hole in while using these hole implant in sinus in upper posterior region where we'll have to see about the sinus. These implants are not preferable. Now the force magnitude in the implant body design. The magnitude of bite and force varies as a function of anatomical region and state of the dentition. Many biocompatible materials are unable to withstand and the type of magnitude of parafunctional loads that may be imposed on the dental implants. Now the next. Influence of the implant body design. The implant body and components are prone to fatigue fractures with incidence reported between 1% to 4% and after 5 to 10 years of loading. The most common cause of long-term failure occurred when the grade 1 titanium implant was used, coupled with less than an ideal treatment plan, that's the higher stress. The typical mechanical failures are due to either static loads or by the fatigue loads. Fatigue load failure happen if the material is subjected to the lower loads but repeated cycles of that load. Now the next slide. Now we'll talk about the summary what we have learned yet. The implant body design is responsible for transmitting the occlusal stress of the prosthesis to the supporting bone. The product used by the implant team may increase or decrease the risk of screw loosening, crestal bone loss, implant body loss or peri-implantitis, aesthetics of the soft tissue drape, and the implant failure, the implant body fracture. Therefore, it's prudent to make a selection based on the scientific approach rather than the selective based on the scientific approach. Then on the advertising, on the marketing opinion, these decisions even more important, hence force factor are greater than usual, bone density is poorer than the usual, or the implant body size is reduced. Now I will conclude this presentation with the following clinical conclusion about various implant thread design features can be drawn. For thread shape, the square thread profile may provide the best primary stability, and while the primary stability is concerned, the implants with the smaller pitch are beneficial by increasing the bone implant contact. Okay. Now the thread depth is more critical for dissipating peak stress within the bone than thread width, and the optimal values of the thread depth and the width may vary depending on the thread shape and their having other geometric factors. So we'll conclude here with the thread shape, the square thread profile having a best primary stability in this implant design. And the primary stability is our main concern while having implants with a smaller pitch are more beneficial than the increasing of the bone implant contact. Okay. The last slide is just remaining. After conclusion, there is one more slide.
Yes, doctor, this is the slide after conclusion.
Yeah, there's one more slide after conclusion.
This is the only slide, doctor, which is after conclusion.
Okay, okay. Last
conclusion,
slide.
And this is the last slide.
Okay, okay, okay.
Yeah.
Okay, any queries, any questions about implant design? Now they can ask if they have any query.
Well, we will conclude the webinar now, guys. And before we conclude the webinar, I would like to present a small presentation on Dentistchannel Online. And I hope you guys learned something from this webinar. I will just share my screen and we will be, yeah, okay. I hope you guys can see it. So a very welcome to World Implant Expo 2021 by Dentistchannel Online. And these are the list of our few keynote speakers at the Expo. Now about Dentistchannel Online. So we are a private limited which leading, so a private limited, and we are leading dental media company that aims to spread awareness and knowledge regarding various aspects of dentistry. We conduct various regular webinars and courses on different areas of dentistry. Being a prime member with Dentistchannel Online brings you with several opportunities, accredited webinars and dental courses. So we have a lot of webinars and a lot of workshops which comes up with the latest advances in dentistry, and it is all aimed for dentists, for upcoming the dental students, maybe interns, maybe dentists. So for them, we do all these webinars and workshops so that you guys are updated with the latest dental techniques and the latest dental trends. Okay, now moving on to being a Prime member with us. So if you are not a Prime member with us, unfortunately, you will not be awarded by a free certificate of participation after every event. So make sure that you are a participant with us. Sorry, you are a Prime member with us. Now, certificate of participation for the Implant Expo 2021 is awarded with 30 CPD points, which contains a lot of value. So make sure you are a Prime member with us, because if you're not a member, you will not be given the certificate of participation. And the membership come with a very, very minimal price of seven USD dollars or 499 Indian rupees. So, and you can enroll with that amount of money for the whole year, and you will be available to, I mean, you can unveil all these amazing offers, webinars, and workshops. Now, this is a small glimpse of our next webinar, which is going to happen tomorrow. That is with Dr. Arul Prakash, Dr. Himadri Chakrabarti, Dr. Himanshu Gupta, and Dr. Johnson James. And these four of them are the most amazing, amazing, amazing speakers we have ever had on our Dentist Channel Online platform. Now, for your latest dental updates, just send your full name to this number. That is 9739368 so that you can be. We will send you the notifications regarding the latest updates and the webinars or workshops. Now, moving on to our sponsors, these are the list of our various sponsors: Monoplant, Novamind, Bicon, Unicorn Denmark, JKT, Shastri Brothers, Simpla Dent. And for our recorded video session, make sure that you follow us on Instagram, on Facebook, on YouTube. And our handle on Instagram is Dentist Channel Online. Even there, we are very much active. So if you have any doubt, any queries, you can DM us there, and we will respond to you as soon as possible. Now we will start with a small promo video. Okay, so guys, this brings us to the end of the webinar, and a link to our Prime membership is mentioned in the chat box. Make sure you guys visit the link. And thank you so much, Dr. Kushal, for coming on board with Dentist Channel Online. Thank you so much, participants, and we are very sorry regarding the technical glitch, and we hope to improve the next time. Thank you so much. Nice to meet you, and we look forward to see you again, participants. Thank you.
Thank you all of you for listening. Thank you, Dentist Channel.